We're really a composite of our life experiences, memory layered upon memory, and Alzheimer's steals that away. This is a quote by Meryl Comer. Now, Alzheimer's is a non-reversible disease of the brain that progressively worsens over time. Usually over many years, the patients become forgetful, they become confused, and their thoughts become tangled in a web of information as they attempt to find the correct words when having a conversation or when they're being questioned. There are many theories about what causes Alzheimer's disease, but it's still not fully understood what actually causes the disease. Some of the facts we know is age is the number one known factor for Alzheimer's disease, and the majority of Alzheimer's disease patients are diagnosed with late onset Alzheimer's, as the patient we're going to discuss later on. Now, there's two types of Alzheimer's disease. There's early onset, which is before 60, and there's late onset, which is commonly diagnosed after age 60. Early onset are both difficult to diagnose. They both usually take years to discover before the patient is diagnosed. It's a long process to believe to cause Alzheimer's disease. The enzyme beta secretase cuts the external portion of the amyloid precursor protein, then forms soluble amyloid precursor protein beta. It's then cut by an enzyme called the gamma secretase, which causes a free-floating fragment of protein called the beta amyloid. The beta amyloid then injures the neurons in the area of the brain that are responsible for producing acetylcholine, which is a neurotransmitter that helps transmit action potentials from one neuron to the other. Now, when the cells die, they begin to form these tangles, which inhibits the information between the neurons. So the action potentials, which is just the electrical signal of the nervous system, how the neurons communicate. Some of the symptoms include mild cognitive impairment, such as memory loss, forgetfulness, such as losing the wallet, keys, phones. This is why it becomes so difficult for us to catch it, because we don't realize this, and sometimes we just put it off as normal everyday forgetfulness. Now, there's no cure for Alzheimer's disease, but after a medical diagnosis is made, a medication is usually prescribed that can help reduce some of the symptoms and possibly slow the disease process. The computed tomography scan can show shrinking of the patient's cerebral cortex, but this is not apparent until the disease progresses beyond the early stages. Now, one patient that comes to mind, very interesting, is an 83-year-old. She has stage 5 Alzheimer's disease. This patient is in a long-term care facility, also known as an old folks home. Excuse me. The patient was diagnosed with late-onset Alzheimer's. She was kind, soft-spoken, and seemed intelligent, and even discussed being a nurse when she was younger. But when she was unable to hold a conversation for more than a minute before she became confused and had to start the conversation over, or she began a new conversation. Now, she remembered who she was, how old she was, and who her family was, and even her career in her younger days. But she could not tell you what today's date was. She was not sure what she had, but she was content with her surroundings. She required some assistance, such as medication administration, constant reminders throughout the day for grooming, social activities, and eating. Constant reassuring and guidance is needed to assist and redirect her throughout the day. As we made contact with this patient several times throughout the year, with information obtained from her daily nurses and certified nursing assistants, it became clear that her cognitive decline was progressing even further, even with the administration of Alzheimer's medication. With advances in the medical field happening every day, it seems there may be hope in the future, but it's important for the nurse to teach the patients and patients' families about the early signs and symptoms of the disease, so we can begin to treat the disease much earlier. The way we can slow down the process.